This is our second virtual town hall on recovery and resilience for the Recovery Advocacy Project. Super excited that so many people have joined us this evening. My name is Ryan Hampton. I am the organizing director of the Recovery Advocacy Project. I'm also a person in long-term recovery, and super excited to be your moderator tonight. I just want to remind all of our panelist members, if you're not on mute, if you could put yourselves on mute unless you are speaking, just because we're getting some background noise. Very much appreciated. So happy that everyone has joined us this evening. But before we get started, I wanted to just take a moment and acknowledge everything that's happening in our world right now. You know, now more than ever, we absolutely need to be talking about resiliency, and specifically systemic resiliency, from COVID-19 to racism. The challenges that we face today have only underscored longstanding disparities in healthcare, criminal justice, equity, employment, opportunity, and so much more. All issues that we here at RAP are committed to working hard on in Nevada. The Recovery Advocacy Project was founded on recovery principles and recovery values. And we just want to remind and encourage all advocates out there to please remain close to your recovery practices and place your principles into action by addressing the institutional challenges and barriers to recovery choice and access for communities, but particularly communities of color, which have historically in the past and continue today to be disproportionately impacted. We reject all forms of racism as destructive to our goals and our mission. As an organization, we here at RAP pledge intentional diversity, equality, and inclusion to always be our guiding light. These conversations that are happening right now here in Nevada and across the country must continue to move forward, and we here at the Recovery Advocacy Project are committed to listening, learning, doing our part, and being a part of the solution. Now, since we got together last April, I think it's become crystal clear for all of our panelists and everyone who's joining how important our work is that we have to get done this year in 2020, 2021, and beyond. And for the past several weeks, our action work groups have been meeting and developing the RAP 2020 to 2021 platform. And before we get into our discussion tonight, our panel discussion, I wanted to share it with you briefly. So our platform is based on 4 main buckets. The first being stigma, second, justice, multiple pathways, and recovery rights are civil rights. And just to give you a brief description of what those mean, at the core of our platform, we stand with policymakers who support and champion recovery choice for all Nevadans. Supporting recovery choice, we believe, strengthens our communities economically, emotionally, and physically. When it comes to stigma, recovery choice is reducing the stigma of addiction and mental health. We must humanize addiction and mental health with person-centered language. And we must support educating the public that recovery is a valuable asset to the community. When it comes to justice, recovery choice is advancing justice, and we must support recovery-oriented options for problem-solving specialty courts. We must decriminalize addiction, and we must ensure civil rights protections for those with addiction and mental health. When it comes to recovery pathways, recovery choice is supporting and embracing all pathways of recovery. We must recognize clinical and non-clinical recovery options. We must inform the government to support the value of recovery in public programs. And we must elevate the profiles of those with lived experience and the benefits of peer support. And when it comes to our 4th platform item, recovery rights or civil rights, recovery choice is protecting consumers. We must ensure fair and equitable access to housing, employment, and services, and we must safeguard the rights of people with addictions and mental health challenges. One last piece of business, and then we're going to dive right into the panel. As we did last time for our first town hall, we would love to learn a little bit more about everybody who is joining us. So a poll is going to jump up on your screen. It's going to ask you what community you represent. We're going to leave this up for about 15 seconds. If you can just, by multiple choice, tell us what community you're coming from. When to our town hall, and then we will get moving forward. Great, and now we will get into our panel discussion. I am incredibly excited to be joined this evening by a great panel for what I hope is going to be a very constructive, informative, and forward-thinking discussion. Many of the questions that we have tonight, I know are on our community's minds these days. We do have questions that have come from the audience, some of them that we will be asking throughout the panel, and then some of them, if we have time, to discuss at the end of the panel. If you didn't have a chance to send your question in, that's okay. You can tweet it to us at recovery_voices. Just send us your question, tweet it to us. We'll be monitoring them, and we will try to get it in at the question section. Again, it's at Recovery Voices. Joining us this evening for our panel, and please help me welcome, is Senator Julia Ratty, State Senator from District 13, Senator Joe Hardy, State Senator from District 12, Assemblyman Steve Yeager from District 9, Stephanie Woodard, DHHS Senior Advisor on Behavioral Health, and we also have a great group of folks who are joining us with lived experience. Lisa Lee, who is a person in recovery, Trin Dang from NAMI, Southern Nevada, Robin Reedy from NAMI, Nevada, Gilbert, who is a young person in recovery, Phoenix Cutler, a person in recovery, Alvin Elliott, a person in recovery, and Donna Dimitrovic, person in recovery and Executive Director of Foundation for Recovery. We're going to go ahead and keep this authentic as possible, members of the panel, and we have a bunch of questions here, and I'm going to go ahead and start with the first one, and any one of you can jump in to answer, and there can be follow-ups, but let's just go ahead and get started. The first question that we have tonight is, how do you believe that resilience moves us forward, especially now with all that our state is facing? I just want to remind you all that you're on mute, so go ahead and unmute yourself, or I can call on someone to get it started. And since you're the first square in my screen, Lisa Lee, I'm going to go ahead and throw this first question to you.
Okay, sure. So how I understand this question is, how does our lived experience with these skills of resilience move us forward during COVID? Do you mean on an individual level or a macro level?
I think on both, and I
Okay.
think on both. Yes.
So individually, I think in the recovery community, I mean, it's hard, right? I mean, this isolating experience of quarantining and whatnot, it's a difficult experience, especially if you have previous, hospitalizations or incarcerations, right? It can be pretty triggering or re-triggering of those experiences. But I think our resilience moves us forward as individuals to reach out and see what we can do to help other people. So I know that, the people in my circle have been extra communicative and supportive, and like, what can I do? Do you need groceries? I've had 2 people in my personal life that were COVID positive. So it was like, well, let's start a brigade of what do you need at your doorstep? So I think, the ability to bounce back and move forward from any kind of challenge helps us, not just on an individual level, but come together and help our community and see what we can do. And that in turn helps reify our own recovery, right?
And I would add to that, I don't think mankind would exist without some form of resilience. Resilience is moving forward. And, each of us has a certain capacity for resilience. And so those that don't have as much resilience, we've got to care for. We've got to work for it. We've got to advocate and support and educate people with resilience. But I think in this time, almost no one has that unmeasurable amount of resilience. I think that's one of the unique things about the time that we're going through right now is everyone gets that this is strange and it's stressful. And so now they're finally kind of feeling what some of us have felt 24/7, 365. And so that maybe the silver lining will be their better understanding that anyone can have anxiety, depression, anyone can have anything. And I know I've talked to a lot of people who are turning to different things to get through it. And sometimes that's alcohol, even for the non-alcoholic. But in this acute measure, I see that out there happening. And so I think they're going to have a better understanding. Not a perfect understanding, but a better one.
Ryan, this is Alvin. Good evening, everyone, and thank you for your opening statement, Ryan. But to answer that question, to me, one of the things that I always look at is, my adversity can also bring an opportunity, and an opportunity for us to be together on this Zoom meeting. I know you said earlier when we were doing our pre-panel workup that almost 400 people sign up. If we were having this meeting actually at one of the locations that we normally have our meetings, 400 people couldn't fit in there. So we get an opportunity to reach people who normally might be too busy or having too many other things going on, so we can reach them and we can share with them. We can share our experience and how we get through crisis. As a person in long-term recovery, which means I haven't had any drugs or alcohol for 34 years. Working on your own personal recovery, particularly early in that time, definitely was a lesson in how to work through crisis.
Thank you.
Real quick?
Yeah, absolutely.
So real quick, let's go and break down what resilience means for a lot of people, because a lot of people don't really even know what resilience is. Resilience basically breaks down to the capacity to recover quickly from difficulties and or toughness. Myself and other people that I know that have had, addictions from whatever substance, that they chose, the only way that they're able to recover from those substances is by a support system. If we don't have a strong support system, guess what? We're not going to recover with any type of resilience. And that's something that we have to work on.
Very well said. How about some of our other policymakers? Stephanie, I'm gonna call on you.
Sure. So really, I think the definition of resilience and the idea that it's about adapting to change and changing environments is really very important. And just to speak to Robin's points, I think that we are all going through this experience of COVID and isolation and senses of disconnection. And it is humbling. I think most of us, especially in a culture where we seek quick fixes, and oftentimes we're very uncomfortable with discomfort, and we want to look for really the fast solution when we have really been faced with not being able to quickly escape and have been faced with our own humanity in the experiences of adversity, whether that's isolation, economic impacts, job loss, or just the day-to-day experiences of anxiety and fear of the unknown. I do hope that it goes a long way to helping us address stigma, because it is really part of that human experience that does tie us all together.
Thank you. And I think to I'm gonna say to all three, to Assemblyman Yeager, Senator Ratty, Senator Hardy, looking at this from more of like systems resiliency, right? We've talked a little bit about personal resiliency, but in terms of the systems resiliency, how are we going to move forward? Especially given all that is happening, it seems seamlessly at once in our state right now. Assemblyman Yeager, you can go first. I'm going to unmute you.
Okay, great. Thank you. Assemblyman Steve Yeager here. That's a great question, and I think it's one we're going to be tasked with as policymakers. And I think for now, we're trying to get out of this, what I think is sort of the darkest days of where we've been, to figure out how to reopen our state. But I think going forward, we have a lot of work ahead of us, because I don't know, you've heard people say the new normal, but I don't think any of us quite know what that is at the moment. But one thing that's become abundantly clear to me, and I think probably everyone else on this call, is that the old way of doing business might not be there anymore for us. So I think I see my role, and I would think that my two colleagues in the Senate would agree that we've got to think outside of the box to be able to create systems, support systems, fund systems, so that if we're in a situation like this again, we're not scrambling to make sure that people can get the help that they need. So, I'm sure we'll get more into it in the discussion, but, things like telemedicine and using, as Alvin said, using this kind of technology where hopefully we can bring more people in than might otherwise be available. And, I'll just take a quick point of personal privilege, if you'll let me. A lot of you know that my wife runs the mental health court and the civil commitment court down here in Clark County. So, we have a lot of discussions about, what is this world that we're living in, and how do you, even from a court perspective, conduct the appropriate overview, encouragement, and support without being able to do it in person, in a courtroom, in support groups. So I think, we'll have to really look at what we have in our state, take an inventory, and figure out what we'll be able to do in this world that we live in to make sure that we're going to be resilient, not just now, but looking forward, if we have a situation like this again. So I know that's not a super specific answer, but I think it's sort of on all of our minds of, once we're able to get together as a legislature and make these decisions, what does that world look like, and how can we support folks and help them be more resilient? And it's why I think, town halls like this are crucial for us, because we're hearing from people that are in this system that have real experience, and hopefully can offer some suggestions for where we can go as a state, as policymakers.
Thank you. Senator Ratty?
Yeah, so I appreciate everybody and everything that was said about the individual resiliency. And I think that, one of the brilliant things about when you are faced with a crisis like that is being able to witness that personal resiliency in individuals, and see the good that comes through the bad. And that, gives me hope that when we start talking about moving from the issues of personal resiliency, which I think there's a lot of abundance of, and you can see it in people across the spectrum, the systemic resiliency, we've got some problems there. And I'm working really hard to get to the optimistic place that Assemblyman Yeager just painted. And I appreciate that everybody has to have that, like, there can be a better way. But I think I think it's incumbent upon us to acknowledge that one of the things that COVID-19 has done is shine a very bright spotlight on the injustice and the inequity within our existing systems. So if you just talk about, who's experiencing homelessness, or who's more likely to live in poverty, or how does health inequity affect how, lower income folks, LGBTQ folks, people of color, have access to resources and services. And, you know, when you talk about that over the history of our country and the cumulative effect of that, and then you throw something like a pandemic on it and you say to folks, well, our number one solution for public health is for you to shelter in place. But then we recognize that we have individuals experiencing homelessness who can't do that. Or we have families from specific cultures where the norm is to have grandma and mom and, you know, family, parent and children and great grandchildren all in one household, and in many cases sharing one restroom. And we put out these like solutions that fit a norm that may make sense for some of our families, but doesn't make sense for all of our families. And so I think where the opportunity is to say, okay, it is nearly impossible at this point to ignore those inequities and to not see those inequities. And so if we're going to have to tear everything down, which at least fiscally we're going to have to do to a certain extent, how do we then build it back up in a way that maybe tackles some of that systemic lack of resiliency for some folks and maybe distribute some of that resiliency in a way that's more equitable? So I've been spending a lot of time thinking about that. I don't have brilliant answers. That's not a switch you just flip and say, hey, we got that done. It's not one bill or even 10 bills or even one legislative session. But I do think that certainly I see people saying things and doing things that even 2 years ago would have been unimaginable in terms of acknowledging the problem and the problems. And so maybe then we can build from that. I think for a lot of white individuals, I'll speak for myself, there's a level of shame that can be leveraged to perhaps turn into action. And, you know, maybe shame shouldn't be the best motivator in the world, but it can be. So that's my very honest, frank, kind of living where I'm living right now today. I would like to see the resiliency spread in a way that is the systemic resiliency. And I don't want to take away from anybody's individual resiliency, because those are two very different things. And I think you see individual resiliency everywhere you look, but the systemic resiliency could be distributed a little bit more fairly, a lot more fairly. Let me not say a little bit.
Thank you, Senator. Thank you very, very much. Senator Hardy, I will unmute you. Garrett, can you help me? Give us 1 second. We're trying to unmute you. Oh, Senator, I think you may need to unmute yourself, actually. There you go.
All right. We've been trying to figure out, you know, how people feel and what they're doing. And I read a good insight just recently that talked about the frustration index. And when you're talking about resiliency, the theory is with resiliency, you get back to where you were before. And I don't think we don't want to be back to where we were before. We want to be beyond. And I appreciated what Alvin said about networks. Then I read another thing. Most of the things I get are because someone else is smarter than me and told me something. So it was very cleverly written. The emotional net worth that we have depends on our network. The people around us, and so, you know, as you think about the people around you, who do you do and what do you do and how do you do things with them? And we all go back to our family and, you know, what it is. But I think one of the things that has helped me recently is just feeling what other people are feeling. So for instance, unemployment, slow payments for government, social isolation, social distancing, rent or mortgage payments overdue, untreated health issues, substance use issues, requirements to wear a face mask, 6 feet rules, stores closed, entertainment and sports not allowed, have all been allowed. Fear, anxiety, anger, and mistrust and lack of control over a vicious virus that creates a societal profound frustration. So we have this frustration, and I looked up trying to figure out a frustration index, and I couldn't find it, but I can tell you the index that we have for frustration is huge on different levels, not limited to one socioeconomic class, not one race. We are all in different circumstances. So a study recently done looked at anxiety in April 2020. And it struck me that between the young adults 18 to 29 years old held the highest anxiety level of 24% had anxiety levels that were increased from a year ago or 2 years ago now, up from 4%. So all of these young people, I'll call them, they're all younger than me, but all these young people have never been through this kind of anxiety provoking experience. The very time where they're supposed to graduate, where they're supposed to get a job, where they're supposed to be away from home, they're now in the most anxious part of their life. So their frustration anxiety level is huge compared to what it was before. So we don't want them to be resilient and go back to where they were. We want them to grow on, to go forward. And so the optimism that we have to have, I think, comes from when we reach out to other people. When we find somebody, for lack of a better word, worse than us. When we find somebody that we can lift as opposed to wait for somebody to lift us. So we can say our prayers for someone else. We can be grateful for what we have. As soon as we've switched from worrying about ourselves to worrying about somebody else, we feel better. And I've tried an experiment personally where I think about somebody and I think, I think they would do well with a phone call. And I call them up and I said, this is my random call to a friend. And then we have a discussion, and the comments after that are, I'm so glad you called. And when somebody says, I'm so glad you called, obviously that makes me feel good. And those reaching out to networks are not necessarily waiting for the network to come to us to rescue us, but to allow us to help lift somebody else. And nobody lifts higher, being lifted higher than the people who are lifting others. And I think one of the things that, I read all these things and they go about, plan, organize, inventive, and health. But sometimes we just have to get down on our knees and we have to say, help, I need help. And then, we get help, and the help comes from somebody else and who helps us and lifts us. And then we in turn get the chance to lift somebody else. So I've had tender conversations with people that I didn't realize that they wanted somebody to call them. And I think when we're waiting for the system to fix this, we're going to miss opportunities that we can help someone else without being directed and told to where to be and what to do. So the higher power concept of addiction, of the recovery, the 12-step, that's huge. I think we are missing the boat if we don't learn from the recovery people the need to recognize that we can't do this by ourselves, no matter how many programs we have, no matter how many special meals that are delivered. We need to depend on somebody who's a whole lot higher than us. And sometimes that somebody higher than us is actually somebody that we didn't esteem before, but when they reach out and help us, then we feel better. And if we have a chance to help somebody else, then we feel better. Okay, I'm off my soapbox.
No, I mean, absolutely. And I think it's a good point. I want to pivot I want to pivot the discussion in between resiliency moving us forward, and some of the priorities and the things that we actually need to be focusing on. And I think it's a good opportunity. I want to reintroduce Gilbert, who's a young person in recovery. And I think kind of when we're in between these two questions, and the next question I'm about to ask, centered on priorities. I mean, Gilbert, being a young person, I mean, you're 16 years old, I understand. You're a young person in recovery. That where you're at requires a tremendous amount of resilience. But I think it would be helpful for the panel and the policymakers and the people who are listening. What exactly did it take for you to get there? Meaning, what supports did you need to be able to enter recovery and maintain it and sustain it at such a young age?
Hello, everybody. I'm Gilbert, a young person in recovery. And for the most part, it's pretty hard recovering from what I recovered from as a teenager because, it's a lot of pressure, and that's kind of a big part of the teenage life, going through that experience. And some of us just don't happen to make it back from it. And, I'm glad that I was able to. My biggest support system of all is my alternative peer group. They allow me a place that's not home and not what I'm used to get away from everything that I go through. Rather, it's stress. I live in a home where my family feel like it's not really a problem to smoke or drink or do substances and keep that going. So my alternative peer group allows me to get away from home and get away from everything so that I could catch my breath and take time to relax and get in a group of people who want the same thing as me. Because I don't know if my family can understand that sometimes it's hard for me standing in a place like that with everything that I go through. But overall, my alternative peer group is my big support system. They help me get out of the house, help me find things to do other than what I used to do. It's a big help. Growing up, I didn't really have the opportunity to go to some places that they take me to, some places that we're able to venture to, some things we're able to do, because my home life was never really the best. But you see, they find ways and make ways to help me out throughout that, find ways to help me better myself and keep myself on track if I start kind of going downhill. And, that's one of my biggest support system of all, because I don't know what I would do if I didn't have a place where I could go throughout the week, where I could just have a moment of peace away from drugs, away from everything that goes on in my daily life. And that's a big help. I think without being able to get out of the position that I was in before, I wouldn't have been able to make it to this point. I stopped using all substances November 23rd, 2019. I should be getting my 7 months this month. And, I plan to keep it going. And with the support of everybody I have, my high school, my alternative peer group, I feel like I could keep everything going.
Yeah. You absolutely can. Well done. And, the peer recovery support services in general. I mean, you ask me what is my, what would be the priority? That's a big priority for me, but I know everybody's got a lot of priorities we want to talk about. So I'm going to go ahead and shift this around again. And I guess we could bounce around, because I think it would be great for all of us to be able to answer this question. Why don't we go ahead and start with, because you are first to my right when I'm looking at my screen, Lisa, I'll start with you.
I'm sorry, what is the question?
What should some of our priorities be?
Oh, and that's a loaded question. That's a very big question. Obviously, I think as Senator Ratty addressed, we have large structural systemic issues that are glaringly obvious at this time, things that have been long lasting, like 400 years. And we're just starting to see these. And I think As far as health disparities, we need to tackle that issue. We need to definitely tackle racial and ethnic disparities. You know, I'm in a public health program now. I comb that data, and I know Senator Ratty probably does as well. Seeing the Latino cases in Washoe County and how just the disparity between other races here, and seeing Native American case counts go up, I think we have a lot of issues to address, and that should be definitely something that we prioritize. And that's complicated, right? You know, just like she said, it goes back to so many different things, you know, depending on public transportation, multi-generational households, language barriers, lack of culturally competent delivered services, lack of linguistically appropriate delivered services. I feel like, especially in Nevada, we have such a high Latino population. I myself identify as Latina, and we lack a lot of providers that are bilingual. We lack appropriate services here. I think we could do better. In addition, we have to prioritize mental health and substance use. I know that that might be an area that looking at funding deficits may be skimped on in the future, but I certainly hope not. Most of my friends are in recovery, but a lot aren't. A lot of them, you know, work in the field, and I've seen evidence of a lot of binge drinking, you know, of folks that are not necessarily, they don't identify as having, you know, problematic or chaotic alcohol use, but I'm seeing that. I'm seeing evidence that all of this in the world has definitely created some issues. So we do need to prioritize in those areas. We are, you know, pretty awful with our mental health. I think we're still 51st in the nation. That's unacceptable. That's an unacceptable place to be. So we have to prioritize those things. And can we talk about gender for a second too?
Yes, absolutely.
While we're making lists. So we need to talk about that too. I know during this COVID crisis, I'm not the only mom that had to, you know, look at balancing career and, you know, taking care of distance learning for our children, right? I'm sure a lot of us know parents that had to make sacrifices so that we could ensure those educational benchmarks were met at home. And unfortunately, we still have a gender wage gap that we need to address as well. And I know that's a big ask, but that's a systemic challenge as well. And I think it's important to the conversation of maintaining and sustaining recovery, as well as lifting future generations. If we're gonna talk about lifting generations out of poverty, then we need to talk about the gender wage gap as well. And I'll just ramble, so I'm gonna.
Thank you, Lisa. I want to, Robin and then Trin, I think. So we'll go in that order, if that's okay.
Thank you. Thank you. So, you know, as with every year, you know, housing, I think the housing situation for those who are unable to get or hold on to housing, and the discrimination that happens with that needs to be addressed. I think the housing is probably one of the #1 calls that we used to get before COVID-19. And I still think it's very problematic. Parity, we need to treat mental health issues and addiction issues like we would treat heart issues or diabetes. You know, this probably everyone here has heard me say this at one time or another, but if we can have insurance companies not just react when someone complains, but have some proactivity in that, where they make sure that they're providing equal coverage and prove it. And then another one would be prescription drugs. You know, talk about those 3 things would help everyone across the board, you know, in doing this. Medicated assisted treatment You know, we need to push to be able to have those. We need to make sure that this antipsychotic drug or antidepressant or whatever is being prescribed, that it's easy for them to get. You know, when you finally get someone to get on a medication for something, you want to do it then, not walk into the pharmacist and find out that it's not covered and you have to take this first, and that could actually map your brain a different way, where the drug that might have worked won't work now. So all of those are problematic in step therapy and different barriers in the prescription area.
Trin, do you want to follow that up?
Yeah, definitely. I would agree with Robin with the housing thing. That's a lot of the calls that I also get in with the NAMI Southern Nevada phone. When I thought of this question, I thought of it on 3 different levels. And I appreciate Gilbert for sharing his story and his resiliency and coping strategies, because I think, you know, on the individual level, our priority is taking care of our mental health needs, finding different coping strategies and resources, and seeking professional help if necessary. As an organization, you know, we're really focused on expanding our services because we know that there's going to be an increase in the need for services. So we're conducting trainings for facilitators, recruiting more volunteers. So it's so important, and we're so thankful for, you know, the additional funding that we're getting down the stream to be able to purchase materials, to be able to conduct our trainings. And as a community, looking to partner with other organizations to ensure that we're supporting each other, so that when people are calling in, although we might not necessarily have the resources or services, we can direct them to partner organizations that can handle that. So really developing those relationships and tightening that up as well. So I really think that's our priorities.
Phoenix?
Thank you. So just to kind of piggyback on a few different things that like Robin had talked about on prescription stuff. You know, myself, I identify as a trans woman. And if I would not have had the support and or the medications that I needed, I possibly would have never gotten clean and or sober. Here in Reno, where I live, there's no support system for that. There's no support system for, you know, anyone that's homosexual or gay. There's nothing like that here. In Las Vegas, there is some, but it's not, you know, exponential. And it definitely isn't in Reno. So one thing that we need to do to overcome a lot of this is get rid of a lot of the barriers. We also need to overcome this and do a lot of extra training with people. You know, because certain things that may work for a cis woman isn't going to work for me because my brain's not wired the same way. You know, a little bit of my story, I was a meth addict from 18 to 32. And if I would not have finally realized through a strong support system who I truly was, I would still be an addict. You know, hormones and a support system and going through therapy, that's what changed my life. And that's only because I was lucky enough to find 1 or 2 people that said, hey, wait, this isn't who you are. Let's take a step back and let's see where we can go and reevaluate the situation. You know, that's once in a blue moon. We don't have that. How are we going to overcome that barrier and actually give people more training and make this easier to find? I just don't know. You know, it starts with people that are higher up than my pay grade. Thank you.
I'm gonna keep this moving, and then I'm intentionally leaving our policymakers for the end on this, if that's okay with you. I'm gonna move to Donna, and then to Alvin, and then we can get into our policymakers for responses on priority items from our panel. Donna.
Okay, so I pretty much agree with what everybody else has said. There's, you know, major systemic issues that have to be at the forefront of what we do, not just now during this time when all of this kind of social unrest is happening, but, you know, a year from now, we still need to be thinking about that kind of stuff and looking at it and trying to make change. You know, I don't have the answers for sure, but I know that being able to, I like what Trin said about the partnerships of organizations within the state. I think that's really important, that we all come together and kind of rally around what needs to be done in our state. And, you know, there's always a need for more mental health and substance use treatment and services. And, you know, if we can all come together and support each other, as well as supporting people in our community, that's going to be important. I do believe that we are going to see, you know, just working with people, being in recovery myself, working with people in recovery, and then being part of a larger community, I can see the impact that everything that it's been happening over the past couple months is having on us as a whole. And I think we're going to see a major influx of people needing support, but not only people in the community, but people in our helping field as well. And we need to be ready for that and stand up a system that can help support not only people in the community, but also the helpers. So that's my 2 cents.
Thank you, Donna. Alvin? You're on mute. There you
Unmute. Yeah, yeah. Thank you, everybody, for sharing. You know, one of the things that I was sitting here taking a note, and the thing that popped in my head is to be a better partner. You know, in terms of, yes, the priorities are going to be very similar, but how we partner together to achieve some of the similar goals. You know, everybody here is, recovery and, resilience, during COVID-19. That's our goal, right? That's our priority was to get on this call and talk about some of the things that we've been talking about. So when I go out after this is over, who do I partner with? There are organizations out here that are doing these things, right? And, I'm a constant volunteer with the advocacy project, recovery coach. I'm working, last election cycle with the Recovery PAC. I get emails all the time from the CARE Coalition, from the PAC Coalition. The Foundation for Recovery is my favorite charity. And these organizations are carrying that message. And as we move into this next phase of, whatever it is, being a better partner with some of the organizations that, are in Nevada will be key for me, to make sure that I reach my hand across. One of the things that I want to do involved with the advocacy project is working with organizations like Hope for Prisoners, right? There's an organization here in Nevada called 100 Black Men. It's a national organization. These organizations are doing things now. They have a foothold in some of the communities and a foothold with certain groups of people that you may not have a connection to. But if I am a good partner, then I am reaching out to them and not waiting for them to come to me, or not staying in my silo where I've been for all these years. I'm reaching out. So I think that, our priorities will be quite similar. It's our working together is where it's going to be key now, because there will not be as many resources. That's just not going to happen. The numbers they're telling us that right now. So we're going to have to work with limited resources. And if we all try to grab our share like we've had before and not work with others, then the communities that we claim we champion will suffer. So that's my 2 cents.
And I just want.
Ryan,
Yep.
do you mind if I add something here?
Yep.
I can't believe in this time that I didn't bring it up in my original comments. The criminal justice program that we have going, and is basically to decriminalize mental health. And our largest institutions for mental health care our detention facilities and our correctional facilities. And, we've been able to bring support groups into the prison system, into the correction system, and they're led and facilitated by people who have been trained by us. So they're actual inmates leading other inmates in a support group with regard to mental health. And we have a program in the North that we are working with people as they go through the mental health court or they go through the drug court and trying to keep them in recovery. And just as we have crisis intervention training that we've helped lead throughout the state in the crisis intervention teams and the training for that, we need to focus on that group of people so that the recidivism will go down, so that there's more understanding within the prison system, and anything that broadens those kind of activities and programs throughout the state will help anyone who may have some kind of contact with the criminal justice system.
Thank you. And I do want to acknowledge before throwing it over to Stephanie for the first responses. We're getting a lot of traffic coming in through the Q&A and actually on the tweet about saying rurals. What are we doing about the rurals? That is a big priority for a lot of the people who are tuning in tonight. So I wanted to make that mention as well. Stephanie, it's all yours. There you go.
All right. So one of the things that has, I think, really come to the forefront through all of the struggles with COVID is that we've come a long way in understanding the foundation of social determinants of health and how they really do have a very significant impact on both risk and resilience of individuals, whether it is poverty or living in areas of high violence, equitable access to healthcare, substance use, mental health disorders, really all of it. And when we were really trying to tackle, at least in the early weeks of COVID, it almost seemed like a lot of that information, a lot of that knowledge had sort of been set off to the side. And really, I think part of our job from a policy standpoint is to make sure that we continuously are bringing those issues to the foreground because we can't lose that knowledge now in informing our approach. There's a lot of wisdom to be gained in a lot of the efforts that we have made, and recognizing that things like health equity and social justice really are the essential underpinnings for us to be able to really evolve to meet the needs of the healthcare and the behavioral health systems. I think also looking at social determinants of health, it's important to keep an eye not only on the need for access to treatment and recovery support services, because absolutely those remain a very high priority, but I think we also have not invested enough in prevention and early intervention. Things like after school programs for children, making sure that we have neighborhoods that are safe, that we have networks of people that are able to have neighbors helping neighbors, working with what we would consider maybe non-traditional partners like faith-based organizations, recognizing that there is a lot of strength that can be built at the community level that is outside of what we would consider sort of the traditional behavioral health structures. I think Lisa said something in some of her opening remarks about recognizing that there is a need for traditional behavioral health when it comes to access to care, but there are also non-traditional methods as well. To be focusing on that not only in the recovery and treatment areas, but also recognizing that there's immense value in making sure that our communities are healthy and safe.
Thank you. Assemblyman Yeager.
Thank you. First, I just want to say how valuable this has been to hear from everybody on their priorities. I'm keeping a list, which you probably can't see very well, but I've got a list, writing down all these things that were said, and obviously they're all very valuable. I would only have a couple that I would add, things that I think we are still lacking on in the state. One's been touched upon a little bit, but that would be network adequacy for folks that are insured either privately or through the state, to make sure that when they reach that point where they're going to get help, we make it as easy as possible. And, I don't know that we've gotten there, because there's a lot of hoops that you have to jump through to get covered. And then I'm glad that Robin brought this up, because the criminal justice system really got me involved in the legislature. And, part of that was seeing a lot of these issues that a lot of my clients had when I used to be a public defender, that got them into the system. And so for a very long time, I have had a desire to see us have some kind of community-based option for law enforcement, because when they encounter a person in crisis, they have like 3 options right now. 1, you just pretend they're not there and you go away and hope everything's going to be okay. 2, you initiate a legal 2000 and you take them to a hospital. Or 3, you take them to jail and you book them there. And it sure would be nice if there was something in the community that was not one of those 3 options, a community-based resource. And I know we've been talking about that for a really long time. It takes resources, but I think it's something that law enforcement would like. And it keeps people out of the criminal justice system, and it keeps people out of the hospital if they don't have to be there, which of course is good for all of us. So those would be the ones that I would add. But I want to thank everybody for sharing their ideas, because I've got this list and I'm going to add them all to my master spreadsheet, which is like way too long at this point, but they're good things to look at and consider as we go into the legislative session.
Thank you. Senator Ratty?
Yeah, I want to echo what Assemblyman Yeager said about, lots of great ideas and great input on this call. And I'm sure in the chat, I've been trying to monitor that as well. And I'll go back and look at the tweet stream too. So I think one of the things, and again, I just want to be frank, when it comes to resources, there's the policy things that we try to do, but there's also our biggest job, which is balancing the budget. And that's going to be a very difficult thing to do. And we are going to lose some things. And, I would love to sit here and tell you that we aren't, that we're going to prioritize all of the wonderful things on that list, but we are. And so I think what's really important is that Alvin just did a lovely job of describing the partnerships and the coalitions. And it's so important that we hear from you about what's most important. Like, if we do have to lose things, let's make sure that we don't lose the most critical things. And I know we are so lean in Nevada when it comes to having the right supports and the right services. But you really do want to have a seat at the table for that kind of a conversation, to make sure that the most important things do get protected, so that when it comes time to build back up, that foundation is there. And then I think, Phoenix, you said that it was above your pay grade. And here's what I will tell you, and particularly in Nevada, we are all you and the legislature. I mean, we really are a representative body. Nobody in the legislature gets a salary or is, we get a tiny little bit of compensation, but it's not a professional job. And the way you make impact in Nevada is by showing up, and those coalitions that were talked about earlier, you can make amazing impact in the state of Nevada, because it is a very accessible government where you can walk in and you can lobby and you can make a difference. And when, it really, like, if everybody who's on this call right now, I don't know if we got to the hundreds that signed up, but if everybody on this call right now showed up at the legislature for 1 or 2 days, it would be astounding. Like, that would get people's attention, because your legislature in the state of Nevada is super accessible. Now, I will say right now, if you're sending us emails between the unemployment insurance, COVID-19, and racial justice, we've got thousands right now. So it's not the best form of advocacy right now. I'm just also being honest about that. And that maybe not everybody on this call knows that in Nevada, it's a part-time legislature. So we keep saying when we're in session. That's because we don't go back to session until February of 2020. In Nevada, we only make our laws every other year for 120 days. And we do all that budget work every other year. Now, you might see some special sessions this time because we're going to have to do some things in the short term. But when we start, you have time between now and February of 2020 to think about what's most important to you, to support the Recovery Advocacy Project, and to share what your priorities are and lift up the voices of the advocacy or the recovery community, to be able to say, all right, we know it's tough out there, but these are the most important things to us. So that, that's not necessarily talking about my priorities, but just to encourage you to say that you really, I know people get disappointed and a little bit jaded when it comes to politics. You know, we barrage you with the worst possible negative advertising for an entire election season, and it's easy to lose hope. And then to see that, you know, we don't make as much progress as we always want to make. But I can tell you, when you don't show up, we make no progress on your issues. And when you do show up, we make some progress on your issues. So I would just encourage everybody as a priority to carve out time for, reach out to your legislator, maybe, again, not this next couple of weeks, but between now and February, get to know them. They want to get to know you. It's very easy to find out who your legislator is. You can go onto the Nevada legislature website and put in your address and it'll tell you who they are. Recovery is something that so many people in the legislature have either experienced personally or through their family, that it has a lot of bipartisan support, but that doesn't necessarily mean it will always rise to the top. So I just really encourage you in that way. And then in terms of the priorities that I would add to the list, because, you know, I don't know how much resources we'll have to build up. I think Senator Hardy said something about, you know, we can't wait for the system to save us or the system to fix it. And I agree with that. But because whether you believe in small government or big government, there is government services. And I think one thing that we really could focus on is fixing the system. And when I say that, I mean that so much of our behavioral health and so much of our substance use comes from trauma that people have experienced in some form or another in their life. And we need to continue to do the work to make sure that it's not government systems that are causing that trauma. So whether you're one of the, at the worst possible level, the police brutality that we've seen over and over and over again, and that's been lifted up with the really challenging events of the last week, or if we're just talking about that person who's been trying to get unemployment insurance for the last 8 weeks, who hasn't made it through the system yet, and the level of frustration and anger and anxiety that they're feeling, and if that turns into trauma, how that down the road could turn into behavioral health or addiction issues. And so I think anything that we can do as leaders to make sure that it's not actually us and our systems that are causing those traumas is going to be really important as well. And so that's, you know, in the jails, in the police, in our health systems, and, you know, the interactions that we have with all of our systems. How do we make them, how do we do better so that all people, you know, that people have a more positive experience with their government?
Thank you. I do want to just mention, because you said something in terms of advocating, and for all of our policymakers, Assemblyman Yeager, Senator Ratty, Senator Hardy, Stephanie, and others, like your commitment to work with not just Recovery Advocacy Project, but our partners, because we are looking to build that broad partnership with other organizations such as NAMI and others in the state, to work with us and understand the issues that are really critical, that serve the most vulnerable. You know, one of the questions I had mapped out here was, how are we going to protect those most vulnerable populations, those most vulnerable citizens, protect the services that they need? Because we all know budget shortfalls are coming. It is inevitable. How do we ensure that the most important services don't make it on the chopping block? And your commitment to work with our community and people who are really on the ground with the lived experience means the world to us. And we will, I don't want to speak for everybody, but I will speak for myself. And I think on behalf of our organization and probably the other people that are on this panel, we will absolutely take you up on that and work with you, because that is the direction that we need to go in to protect our communities. Thank you for that. Senator Hardy.
One more thing, Ryan.
Sure.
I just want to point out, for every adult who shows up, it's fantastic. But for the folks on this call who are a little bit younger, for every teenager that walks in the building, you get like tenfold the impact, because your legislators are so excited to see you there. And, you know, that goes up to, I'd say, 25. Like, when young people show up, maybe you don't feel heard in other spaces, but young people turn legislator votes on a pretty regular basis, because it's hard to look a young person in the eye when they're telling you their truth and not do what you can to support that.
Thank you. Senator Hardy, wanted to give you a chance for some response on the priorities and the conversation before we move into our next section of the program.
When Robin talked about medication-assisted treatment, you know, it's critical that we have access to that far more than what we're doing. We know that when a person's in crisis, they need an answer now, and that's one of the things that 211 gives us. You know, I picked up somebody on the street and he gave me his story, and I called 211 and they said, okay, do this, do that. We have things in place that we can use, and we don't necessarily use them. I think we also need to develop a more talked about ability to have applications. We call those apps now because we can't spell application. So we have apps that we can use. I'm on a neighborhood app, for instance. And so somebody calls up and they said, does anybody have the ability to move my whatever it is? And people answer it. We have been put in a position with this COVID-19 that we've never been put in before, of needing other people to help us. So we keep thinking that we're always looking at the poor people, or, you know, a demographic of some kind. We're all in need right now. So everybody has a need, and when we start looking at different apps that we can use that people can do that, I think we need to look at that and have and develop what I would call a pairing of peers. Now, there was a time in the legislature that the legislature tried to do away with peers, and we didn't do that. We have to recognize that peers are powerful, and if we develop a system where we recognize, honor, and give credence to the power of peer support, it is huge. It's not just a network of your friends, but it's a network of people who have been there, done that, or don't want to do it anymore and can help you not do it anymore. So our family, our friends, I mean, it's very rare family that hasn't had some, you know, that you didn't let us put our polling on as panelists because that would be unfair. But if you had, you would probably have found every family has had somebody who's in need of some addiction, mental illness. I mean, it's just how it works. So we need to recognize that as we expand our admit that we have a challenge, then we get help. And maybe I shouldn't say this, but so I had a problem with one of my kids. So I said, you know, I can't solve this. So I went to the counselor, and the counselor told me, well, you're not in control. I said, yeah, that's why I'm here. I like to be in control. And, well, you weren't in control when the kid was 2 years old. I said, so you're trying to tell me what I tell other people? And he said, yeah. I said, well, okay, that was the end of my counseling. And I just realized that that was the way it was going to be. And I didn't have to worry. That was something that I could live with and move on. We keep thinking we are going to be completely well, and we're not. We will all have problems. We will all have opportunities to get help from somebody else, and we'll all have opportunities to help somebody else if we're willing to. And so our peers are important for us. And I think one of the most powerful things we can do is find work. You know, we talked about the gender pay gap. Well, if we have the ability to work, we have a huge opportunity to feel better about ourselves, to buy things, to be able to pay our rent, to not be homeless. And, you know, different people have done it different ways, but one of the most powerful things you can do for a homeless person is find them somewhere to live so they can have a phone call where they can get work. And I think those kinds of programs are as powerful as anything where you have the ability to work. It's very therapeutic. So I think in faced with the challenges that we're going to have in budgets, we need to make sure that we have apps that connect people. We have telecare. We have tele this, tele that, tell a friend, tell a peer. We need to develop those kinds of things. They're cheap, they're easy, and they're helpful. When I go to St. Timothy's in Henderson, and I carry in a load of water, they're thrilled. When I'm there serving a meal and some homeless person says, "Could I have an extra serving?" And I say yes. All of those things are available for anybody to go in and help somebody else. Helping other people is very therapeutic for us. And so we need to admit that. We need to give people those opportunities.
Absolutely.
My soapbox again.
No worries. I do want to leave a little bit of time before I've got one or two questions that have come from the audience. I'm going to try and squeeze in if we have some time before we close. But I wanted Trin to bounce the conversation your way, if that's okay, because I think it would be helpful, particularly for the audience that's joining us, to maybe learn about some of the ways people can get involved, but also some of the resources that are out there that NAMI is providing. The floor is all yours.
Thank you so much, Ryan. And I think this kind of goes back and touches on our first question where we talked about resiliency and what Gilbert talked about, what Senator Hardy just talked about with the peer support, and also what Robin had mentioned with just being able to reach out to others. And what we offer is support groups. And so with people who are going through challenges, through struggles, having someone that they can lean to, because not everyone has the same level of resiliency, we can learn from each other. And that's a powerful thing when people are able to reach out and say, hey, I'm going through this. And then someone joins the group that's new and is able to say, you know what kind of things have worked for you? And they're able to learn from each other. So our support groups has been going strong, and we meet weekly. Everything's virtual and online now. So to address some of the concerns in the rural areas, I know before there were transportation barriers and things like that. The beauty that comes out of this is that because we've moved everything virtually, anyone in our area can join. Someone from Mesquite, someone from Moaco Valley, or any of our surrounding rural areas can go onto our website at www.namisouthernevada.org, go to our support group tab, and be able to register and be able to join our support groups on there. We also have education classes, which we just started our family to family education course this Monday, and it runs for 8 weeks long. The difference between that and a support group is that there's actually a whole curriculum that family members go through together where they read about the different mental health conditions, about the different symptoms, about medications, what treats what, different side effects. But then they're also learning empathy at the same time of understanding why sometimes our family members might not be medication compliant because of all the side effects, or how to communicate with our loved ones, especially when they're in an episode, how to set boundaries and have self-care for ourselves while caring for a loved one. So all these information that they learn, they also have time to discuss it with each other as family members to kind of process through their own experiences and be able to connect with other family members. So that's just as powerful as well. And we still continue to have our presentations. So we are looking to train more people and finding ways of moving our presentations virtually to be able to reach different audiences as well.
Thank you. I want to.
So how much do you charge?
Everything is free of charge, because the last thing we want family members and individuals to worry about is how they're going to pay for these resources. So that's where the funding, our donors, we're really grateful for, all the funding that we get to be able to support our community, because we don't want that to be a barrier for people.
Great. And then Donna and Sean from Foundation for Recovery.
Hi, everybody. It's so great to be here this evening, and thank you so much, Ryan, for allowing Foundation for Recovery to share with everyone that's viewing and the panelists some of the things that we're working on and ways to get involved. And for anyone out there who might be tuning in, who maybe has a loved one who needs help, or if you yourself needs help, I just put up on the screen some resources that are available. Right now we have our Nevada Peer Warm line. So anybody can call into this line statewide, and they'll be connected with the peer recovery support specialist, somebody who has lived experience, somebody who has been in similar situations and can help you navigate through whatever situation you're currently going through without any sort of shame or judgment. For anyone who's tuning in who is a little bit more tech savvy, you can go ahead and scan this QR code or just go to www.forrecovery.org. On our website, in addition to all the different workshops and trainings and information on where to find us and get involved and advocate, during COVID-19, we did have a rapid response to moving many services to a virtual format. So we had developed this online hub, or this online space where anyone can go to. You're able to find a list of many different mutual aid meetings, support groups for both family members and individuals. You're able to connect one-on-one with a peer recovery support specialist. And it's another place to find resources, whether that's food, to look at updates from the state on COVID in real time, and a variety of other resources. So if anyone needs resources currently, feel free to go online and check that out. I will say also, so Foundation for Recovery, for anyone who is unfamiliar with our organization, we are a charitable nonprofit. We are a recovery community organization. And what that means is we're comprised of volunteers and staff members who themselves are people in recovery from substance use and mental health challenges. So we're here for anybody that needs help. We provide 3 main pillars of programming. So very much like NAMI and what Trin had mentioned, we do education, free education and trainings, both virtually and in person in communities all across the state of Nevada. We do peer recovery support, one-on-one and in group supports. And we also do advocacy work. So as Senator Ratty had mentioned, how important it is for us to show up and to get involved and let our voices be heard. These are some of the things that Foundation for Recovery is working on currently. So if anybody wants to get more involved with Foundation for Recovery and the things that we are working on, feel free to visit our website and reach out to us. We'll return your response as soon as possible. And again, just really great conversations here. I love the theme of talking about system integration and resiliency. And I look forward to the day that we no longer have to say, you know, when someone presents with having an issue, we no longer have to say, well, go over there to go find help, right? And instead, this help, recovery supports, are integrated in our existing systems, whether that be the criminal justice system, our healthcare system, but also right there within our workplace, right? Right there within our schools. I'm looking forward to when that happens and when we can build a statewide recovery-oriented system of care. So thank you so much for the time, and I'll turn it back over to you, Ryan.
Thank you. Thank you, Sean. So we're quickly running out of time. These go very quickly. For me in particular, I would like to, there is a question that came from the north from Denise, and I guess we could focus for this question first, both Senator Ratty and Lisa, if that's okay. It's regarding services for the homeless. Denise said services for the homeless are changing. Be great to hear how Reno and Sparks are dealing with this. People are in need of everything from housing to access to a computer, their basic wants and needs. Can you please talk about how event centers, libraries, other downtown Reno and Sparks services are when they're reopening, where counselors should send people who need all kinds of services for the homeless?
This is my topic. This is my whole heart and my whole world right here. If you don't mind if I jump in.
Sure.
So we spend every single day out in one of the largest encampments. Again, just highlighting how meaningful this is. Our team at Foundation for Recovery has shown up 7 days a week, especially during the closures, to ensure that people have access to clean water, necessary supplies, food, hygiene kits, first aid kits, all of the things. Really trying to meet people where they are. Just today, I was able to get a veteran hooked up with the HUD VASH team. So there are resources there, although definitely during COVID, it has been super difficult to get anybody into a recovery housing program. Everyone, has been very innovative, actually, with continuing to operate, but looking very different than pre-COVID times. Nonetheless, we're out there still trying to get people in housing. The shelter system up here in Washoe County is in flux. I'm also a member of Reno Initiative for Shelter and Equality, an organization that I've been with for quite some time. We are the new operator for the Women's and Family Shelter. We're super excited. We're moving families over starting Monday, and women over to the new shelters starting the 15th. So I'll be taking vacation time to go sanitize mattresses and move, schlep mattresses all day to the new shelters. So it is in flux. And hopefully with the expansion between the Partnership for Reno Initiative for Shelter and Equality and Washoe County Human Services Agency, we'll be able to expand capacity, and not just for women and families, but also, the current campus will expand services for men. So that is going to look vastly different in the next coming weeks. We're not really quite sure how that's going to look, but we know that it will be much better than the current system now. And then I think Senator Ratty can speak to the movement of the existing shelters into Reno Event Center to respond to COVID.
Yeah, I think what I would say is that I think our community did a nice job stepping up to meet the immediate crisis, right? That when the governor closed businesses on I believe it was March 18th, and that was like 1 or 2 days right after the health district had given guidance to the homeless shelter about some steps that they might need to take to reduce the spread, which resulted in, very understandably, the operators having to tighten down on some access to services to make sure that we weren't spreading. But what we had was sort of a perfect storm where people lost access, like as businesses closed and the shelter had to tighten down a little bit, people lost access to like 800 people who had no place to go to the bathroom. Like this very basic level of response, and a good partnership of government and nonprofit providers and advocates stepped up, and within 2 days, which in government speed is phenomenal, we were able to open the Reno Event Center as a socially distanced shelter with a full 6 feet of circumference for people to sleep. We were able to get bathrooms out into the community in 19 locations, and that had been kind of a fight for a while of could we get porta potties out into the community, and sort of overnight we did. Hand washing stations, those kind of basic survival things. We also, for almost 3 months, were able to follow the CDC guidance to say we weren't going to disperse encampments, because of course there's the shelter population, but there's also the folks who choose not to use the shelter and who are living in other places in the community. And so that held for a while. We are now kind of moving back to the old way of doing things. And so I agree with Lisa that there's a lot of optimism for what could be. And there's some good steps that are happening, particularly for women and families with new models. And we are right in the middle of, as a community, renegotiating our contract with the shelter operator for the remaining men's campus. And because the women and families are moving out, there's some opportunities there with more possible transitional living spaces. So there's a lot of potential. But I would say we have one foot in the old world and the old way of doing things that is sort of a low barrier shelter, but not enough access to housing, behavioral health, wraparound services. And we have one foot in a newer world that has a lot of potential. And we still got to take a lot of steps in that direction. And so it's tenuous at this time, lots of potential, but it's tenuous. So again, those partnerships are going to be critically important. We need to set down our turf wars and work across governmental boundaries and nonprofit boundaries and all of the other stakeholders like police and advocates to figure out. And there is, we do have the county leading a collaborative effort called Built for Zero. It's brought in some outside consultants. And so I hope that that will bear some fruit. It's just in the interim while we're working to make it better, there's still some things that aren't great. So there's tremendous potential, some really good things happening, but it's tenuous, and I want to make sure that we're nudging in the right direction.
Lisa, we could get a 1 minute follow-up for Lisa because we have one last question I want to get in. Okay.
Okay, I'm sorry, and thank you for your time. I just forgot two things. So one thing is at the Reno Initiative for Shelter and Equality, new partnership shelter with Washoe County Human Services at our place. We have a large peer staff that's really on fire for providing that recovery support for people and being the hope dealers that they are out there. So that's really exciting. And I also wanted to say that we're in unprecedented times as far as us being able to push forward a safe camp initiative. This is something that we've been working on for years in this community. And it was finally on the Community Homelessness Advisory Board agenda just on Monday. However, that meeting was canceled and we were pushed off until July, but that is something on the horizon as well. Again, bringing recovery supports to people who are not appropriate for other sorts of shelter systems. So,
thank you. And we have one last question that's come through for Gilbert. Gilbert, you get the last question of the night. The question is, what are your aspirations? What are your aspirations for yourself? What are your aspirations for your state? And is there anything you would actually like to say to your legislators? You heard Senator Ratty. I think they're all listening. So it's all yours, Gilbert.
I don't think there's really much I really have to say. You know, I'm very happy to be able to be on this panel with everybody. You know, this is a pretty big honor. You know, as far as my aspirations, you know, that's
Thank you.
my bad.
No, it's all good. Thank you. And
you got this, Gilbert. You got it.
I had to look up the word real quick just so I could a hope and a vision of achieving something.
Yes, sir. Goals.
So as far as now, my goals is to stay on the track that I'm on right now. You know, I've came a long way from where I used to be, and I plan on keeping it that way. Right now, my biggest goal is getting all my everything that I need in order to start working and get myself on a better track. Because, you know, I moved out here to Nevada after Hurricane Katrina happened, and that kind of lost all of my information as birth certificate, social security card. So, you know, I'm still working on getting myself together so far so that I could better myself in the future. I overall want to get into becoming a cell tower technician. That's my overall goal for everything. That's where I want to have my ending point. But, you know, to get to that point, I have to stay on the track that I'm on. I plan on just keep going on the same path that I'm on so far, going to meetings, speaking out, making sure that I do everything to keep myself on a path and not fall back off. Because there's been many times where I've been on the right path, everything was going good, and all it took was one slip up for me to fall off track. So, you know, as of now, my biggest goal is keeping myself on track and going forward into a better future and not going backwards anymore. If you can understand that, it's a big thing for me because I'm not used to being in the position that I'm in right now, and it's a very big position. I'm happy to be able to be on a panel with senators and assemblymen. You know, that's something that I never guessed would ever happen to me in the past. But, you know, it's a big honor to be able to be here and speak, be able to be here and be heard by such high people. You know, as far as now, I just plan on keeping on the path that I'm on and, you know, striving to do better and keep myself in a better position.
Thank you. Thank you very much. And thank you to all the panelists. Thank you to everybody who joined us. I just want to remind folks, if you would like some more information to learn more about Recovery Advocacy Project, you could visit us at recoveryvoices.com. Also, feel free to keep tweeting in your questions at recovery_voices. We'll be sure to respond to each and every one individually. Very grateful for your time and just hope everybody stays safe and well out there. And thank you all very much. Have a good evening.